jungle.
Hi guys, what's up? This is the leader of Psych Group 2 informing you guys about community diagnosis. But first, let's tackle the learning objectives that the students will be able to understand at the end of the lesson. Number 1. First, we'll need to be informed of the basic principles of community diagnosis. Number 2, realize it's important. And lastly, appreciate the active role of each participant involved. So community diagnosis. Community diagnosis, it involves the specific analyzation of community collection data and identifying their health problems to further plan interventions and solutions. Okay, so para magkaroon tayo ng impact sa contribution, improvement, and overall pag-engage sa community service, we first need to have community diagnosis. Meaning, kailangan muna natin magkaroon ng assessment and analyzation. In simpler terms, we need to address, examine, and evaluate the situation first before taking an action towards the community's concern.
Community needs assessment seeks to gather accurate information representative of the needs of a community. Ito ay isang proseso na kung saan kumukuha sila ng mga impormasyon sa isang community, and kapag nakuha na nila yung mga information na yon, alam na nila kung ano ba ang need or problema ng community na yon. Comprehensive community diagnosis aims to obtain general information about the community. You need to gather a general information sa isang community para mas malaman mo kung ano ba talaga yung problema nila. Problem-oriented community diagnosis is the type of assessment that responds to particular needs. Ito ay kapag pumunta ka sa isang community, alam mo na agad kung ano yung problema. Like sa Marikina, 'di ba? Alam na natin na bahain doon. So, ayun yung problem-oriented. Alam mo na yung problema ng isang community.
Demographic refers to the description of characteristics of some target audience, customer base, or population. Malaki ang significant ng demography in terms of government matters kasi through the info gathered, dun sila bumabase para mas makagawa ng policy or batas sa welfare community. Social, economic, and cultural variables refers to the communication, transportation, education, and the housing condition of the community. We also need to consider the poverty level and the rate of unemployed in the community. Health and illness patterns. In this element, we need to gather morbidity and mortality, and also hospital admission. Health resources refers to empower institutional and natural resources provided not only by the state, but those are contributed by the private sector and NGOs. Political leader pattern reflects the action potential of the state and its people to address problems of the community. Titignan po dito kung paano yung concern ng government as a leader for the welfare of the community.
What community diagnosis does? Community diagnosis is to define existing problems, determine available resources, and set priorities for planning, implementing, and evaluating health action by and for the community. The 11 steps of conducting community diagnosis is first, to determine the objectives of the community diagnosis. The nurse decides on the depth and scope of the data she needs to gather, but whether she undertakes a comprehensive or a problem-oriented community diagnosis. Dever explains that the nurse must determine the occurrence and distribution of selected environmental, socioeconomic, and behavioral conditions important to disease control and wellness promotion, and clearly articulate the goals of community diagnosis. This could include improving health outcomes, identifying areas for intervention, or assessing the effectiveness of existing programs.
Defining the study population is so you can get the important information you need on your
own target to get a good diagnosis process. Mahalaga ang pagkuha ng populasyon para malaman ang kalusugan ng isang tao. Siyempre mahalagang tulong din ito sa mga mananaliksik para malaman nila kung gaano marami ang individual na dapat nilang tulungan batay sa kanilang pinag-aaralan. Determining the data to be collected is important for community well-being because you need to know their condition like health needs, any challenges, and others. Ang pagkuha naman ng data ay nakabatay sa health behaviors, environmental factors at demographic na siyang mahalaga para sa isang community para malaman ang mga needs nila sa kanilang health, mga hamon sa buhay at syempre kung ano naman ang ginawa nila para mag-improve sila. Community diagnosis involves gathering data on demographic health, behaviors, and environment factors and health services to understand the community health landscape and development effectively in intervention. Ang pagkuha ng data ay mahalaga para sa information ng isang tao. Isa na rin ang kanilang kalusugan na nagsisilbi rin itong makakaintindi ng mga pangyayari sa community at mga pangangailangan para sa maayos na kalusugan.
Developing the instrument, mga kagamitan na gagamitin or reused to gather data. Most common na ginagamit yung survey questionnaire, focus group discussion guide, key informant interview guide, observation checklist. Other than that, actual data gathering or data collection. This is the process of gathering and measuring information on variables of interest and establish that enables one to answer stated research questionnaire, test hypotheses, and evaluate outcomes.
Data collation is the process of cleaning up conducting recurrent pieces of hidden information so that similarities and recurrence can be seen. Data collation is ginagamit to para mag-differentiate yung yung mga nag-gathered yung mga information na data and collect and arrange the sheets of a report book, etc. in the correct order. Ayun po ang ibig sabihin ng data collection.
Data presentation is a process to which we utilize a visual aid in representing the data that has been gathered. It organizes information into thought flows that can be easily understood and easily explained. Data analysis analyzes data that has been gathered for the study. It is crucial on which data should be retained and discarded, allowing for effective distribution of information and easier to utilize the data within the discussed project. Identifying the community problems is an important factor in order to assess the community's overall well-being. By assessing the community problems, we are able to locate, understand, and resolve the issues at hand. One such ways of identifying the community problems is by interviewing the residents themselves. By gathering the data and analyzing from the residents themselves, we are able to understand or identify the issues that have been occurring within the community. And we are able to proceed to the next step in order to resolve the issues at hand. Priority setting is a process that we use in order to assist within decision making. By prioritizing which work or project the resources should be allocated to, we can effectively utilize our capabilities in an efficient manner. Priority setting can also be used outside resource allocation. For example, determining which research material should be included within your research paper. Should they fit the criteria or the requirements that you have placed within them? In simpler terms, priority setting is a way to determine which decisions should be deemed important or which decisions should give you the best result.